Okay. Okay, so I'm back with the lovely panel. All right, I'm going to start over at this end. We've already introduced Angela, so no more. Everybody's been here for the first part of it. So next we have Rebekka, and Rebekka currently is working at Drexel University as a research fellow, and she is going to very shortly, now, soon, fingers crossed, potentially, maybe, be starting a job at the Film Guidance Center.
No, that's on Monday.
Yes.
Mazel tov.
Oh, what is the anticipatory stuff now that dissertation?
I thought dissertation.
Oh yeah, so Rebekka is also a doctoral candidate in the PhD program here in creative arts therapies. In the depths of her dissertation research, working with refugees. Her areas of interest merge trauma and refugees. And I asked what your areas of interest were to each person, and Rebekka said, trauma, refugees, anyone really. Which I think speaks to Rebekka's heart. Next is Amy, and Amy is currently working at the Greater Philadelphia Health Action, community mental health, with a focus towards trauma, LGBTQIA, and eye movement desensitization and reprocessing, additionally trauma-informed yoga, Amy Capomacchio, and Rebekka Dieterich-Hartwell, and Mynesha Whyte. And Mynesha is currently working at the Philadelphia Juvenile Justice Services, also known as the Study Center, working primarily with adolescents and adults with trauma and/or acute mental illnesses. And Mynesha is passionate about increasing the diversity and representation and cultural awareness in mental health systems, and dance therapy specifically, super, super important work that everybody up here is doing, and is an advocate for improving the quality of life of people of color in the United States. So the way we're going to do the panel, I thought perhaps we could start with 10 minutes per panelist to just kind of give you an overview about the work that they do, hopefully specifically with the populations that they're focused on. So 10 minutes each, and then I may ask them to speak openly as a panel about 2 more considerations, and then we'll open up for a dialogue between everybody. So please welcome our continuing the conversation panel.
I personally don't feel like we need to go down the line, so to any of my esteemed co-panelists would like to jump in.
Yeah.
You see this? They're picking on the aged person. It's starting. It's happening already.
I just ripped the band-aid off. So I'm Erika. And yeah, so I guess I wanted to talk about, I'll sort of explain some of the different settings that I've been in, and then more just like the focuses and my interests at this point in my work. So from starting the program until now, I've worked in a psych hospital, partial hospital, psych rehab program, worked at the Center for Autism, so more of like a partial, kids come for most of the day and leave, and then now working in outpatient, so I've really kind of like done the range of different settings, which I feel like has given me a lot of different things to think about in terms of how mental health is delivered and how mental health services are delivered in our city. And so my main kind of like obsession and focus is just this intersection of healing work and anti-oppression or like collective liberation work, and anything that kind of falls into that intersection I feel really excited about. So kind of the 3 of the main ways that that's come out for me. One is sort of doing my own work and talking to other clinicians about doing their own work of dismantling kind of internalized oppressions or privileges, and really like doing that internal, deep, kind of uncomfortable work so that we're like creating safer spaces and being able to like work towards a more just and human world, because the more that we kind of understand what those oppressions look like, and then learn how they manifest in us, the more we can be kind of conscious about not replicating them and living into like a better vision of how we want to be. And let's see, I was going to give one example of that. There's a woman, Layla Saad, who's an activist and speaker, and she published this workbook called the Me and White Supremacy Workbook. So for like anyone who holds white privilege, to really examine like all these different areas of white privilege and white supremacy, and really like untangle those things in ourselves. So the other thing, the second thing, is advocating for systems change, and that's something that I want to do a lot more of. But so far, when I was working at the Wedge a few years ago, we had a team together to try to make the organization more trans competent and trans inclusive, and so we got together for I think like 5 or 6 different meetings over maybe a 5 or 6 month period, and just talked about all the different facets of making the organization trans inclusive. And I actually brought the Leeway Foundation came out with this really great guide called Transforming Inclusion, which is about how to make your organization more trans inclusive and competent, which is gorgeous. So if you want to look through it, and I have a couple that are my own at home, and I have 3 here. So if you were like, I need this for our organization, they're free, and you're welcome to take one that I have. You can also order them online as well. And the third part is, I would say like my overall philosophy of mental health as a more, like being inspired by things like the Icarus Project and radical mental health models that really ask the question, like what does it mean to be crazy in a crazy world? So I feel like that's just something that a framework that I bring, like trying not to stigmatize certain behaviors, or really looking at, like, I think it was mentioned in the workshop a bunch, like this person is engaging in this behavior, instead of saying like, why are you so aggressive, or like, let's help you calm down, like really asking what is what's the purpose of this behavior, what's the context, and maybe it's not working so well in this group for a group dynamic or something, but this is like something that's helped this person survive, or is just essential to their being. So just really trying to take that perspective on anyone that I see and work with. And I guess the other thing to fold into here, just because of the experiencing different settings, I have just been really curious about alternative delivery of mental health, or just all the different ways that we can provide services that aren't just like outpatient. And so working in a psych rehab program was really interesting, because there was a lot of just community work. Like we're processing things as a community. We're like having the members take on a lot of responsibilities for meetings, and we're how can we kind of use this little micro system to help people feel empowered in their lives outside. So those are kind of my interests and obsessions. And I currently work in outpatient with a whole range of ages, which is like exciting and problematic at times, because it's such a wide range that I feel like we could specify more. But so that's what's going on for me.
I'm Mynesha. I graduated from Drexel in 2015. Since then, I've also been in a couple different settings. My first job out of grad school in girls residential, adolescent girls residential. Then I was inpatient at Friends Hospital. Now I work at the Juvenile Justice Services Center, as Jason said, also called the Youth Study Center, the Center, the Youth. I may refer to them as all of those as I talk. So that's how we call them at work, which is Philadelphia's secure detention facility for adolescents. So the age range is 13 to 21, but as young as 11. There was recently a law that was passed that said we could hold kids as young as 10 with certain type of criminal charges. So the youngest we've had is 11, fresh 11. So it's really a range. Primarily my work at the Youth Study Center is individual therapy, so I've also been trained in, we're in the process of being certified in TFCBT, trauma-focused cognitive behavioral therapy, which is a really great structured, trauma-informed theory, thought, intervention. So my passion, I guess, my population that's close to my heart are adolescents, which is like a niche thing because you say adolescents, people are like, oh my God, no. For me, that's the sweet spot. It speaks to my personality and also just speaks to my experience growing up and knowing that's just a really good spot to help intervene. A lot of times I find just in mental health in general, people kind of go in the spectrum, adults or kids, and like adolescents, kind of that forgotten age where it's like we don't want to touch them. But I feel like it's a really rich and healthy and a great spot, a great age group to really dive into and really help and guide, because one positive, supportive, constant person can really guide the path to something better, right, to something more healthy, more growth. Of course, being in America in a juvenile detention center, we know that there are inequalities in detaining and criminal behavior and equalized arrests. So a lot of the people that I work with are boys of color, Black, Latino, boys. The average length of stay at the center is 7 to 10 days, but a lot of times it becomes like 30 plus days. I think right now our average length of stay is 28 days. So the youth detention center, the youth study center, we are a holding facility. So the kids come there pre or post adjudicatory, meaning before they have a ruling on their charge or after, and they're usually going to another placement. So their time there, no matter how long it is, it doesn't count towards whatever their sentence or whatever their punishment is. So we've had a few anomalies there for close to a year, and then they had to go somewhere else and complete whatever their ruling is, whatever their punishment is. So another 12 months at a residential type setting, another 6 months on probation. And so a lot of the things that we see there as far as charges are a lot of drug-related charges, some weapons charges, a lot of assault charges usually happening like in school and in the community. So fights and the police are called and some kids get arrested and now they have this assault charge, and a lot of probation violations. What's interesting about the Youth Study Center, what my biggest, I guess a lot of the knowledge that I've gained is the different entities and the different systems that are kind of come to intersect with the kids there. So it's a juvenile justice system, you have family court, the court system. You also have a lot of kids that are involved in DHS. So different interventions with their family, rights terminated, a lot of foster kids, kids coming from group homes, kinship care kids. You also have the mental health system, so CBH is involved in a lot of it, community behavioral health, which is the managed care company for mental health services in Philadelphia. So we have you have probation, which is a part of the courts but separate. So we have all of these intersecting entities, intersecting systems that are involved in the kids, and what I'm learning as I work there more and more is that we don't communicate very well. So I see one thing, they have previous mental health providers see another thing, you have the probation officer working on another thing, and you have the judge having their own perspective and wanting one thing. And a lot of times we really do a disservice to the kids here because we don't communicate, and so we all see different things, and it's hard to get a full picture of the child. So that's something that myself and my coworker are working towards, trying to integrate better, trying to communicate with the different entities, because it's really important. And also, it's one of my passions is like increasing the resources, the availability, the integration for under-resourced communities, because a lot of it is, these teenagers, adolescents, these families need community-based services, but there aren't a lot, right? There aren't that many, and the interventions that would be helpful, we aren't funding, we aren't giving them. The probation officers, I keep saying parole, the probation officers, the judges don't know, so they don't refer them, so they don't get the help that they need, right? And again, it's mostly people of color, so urban, low SES areas, food deserts, all these things, all these intersections of trauma. so I'm really passionate about working on that. A lot of my work there is primarily verbal therapy, so as I stay there longer and growing and learning more about the system, I'm trying to incorporate more movement, more non-verbal interventions. A lot of my work now is using my observational skills in the session to bring up body cues about what people are feeling and trying to give language. So as I continue to grow and learn in that position, I want to do more of that. Also, in integrating and learning and growing, also sharing that knowledge with other people. So sharing that knowledge with the people that are involved with the kids and just other clinicians and professionals that I come into contact with to help have a better picture of the kids that are alive and the needs of the kids in the community at large.
So I'm Amy. I also use AIMS. So I know we had done introductions earlier. So I use AIME professionally. AIMS I use in more social context. Y'all are welcome to use either. For me personally, that's just easier, and for a bunch of reasons which I'll get to cover as we kind of go through this. I got 10 minutes. I'm not going to be able to I'm not going to try to do a comprehensive LGBT competency in 10 minutes. That's impossible. So I'm just going to try to drop a bunch of, like, here's some considerations. Here's some things to, like, look out for. But please, use the internet. And also feel free to, like, ask me individual questions later. There's tons of great resources on the internet. One of those being, so I was thinking a lot about how integral language is to working with all these populations. I mean, there's like so much shorthand and like SES. Working with LGBT populations is like, yeah. There's literally, I was gonna have this whole have like a glossary for everybody because, but it was so many pages, so many terms, and like things that I'm constantly. I was like, what is that? I've never heard of that one. And so what's important about the language is that it's constantly evolving and very personal. So when I say I'm queer and non-binary and gender fluid, that can mean something really different to somebody else, you know, and asking them what they mean. Because also, even historically, so a word like queer used to be used and leveraged as, you know, negatively. You know, I personally used it as a kid. It's like, oh my God, that's so queer. And that was a bad thing. And now I'm like, I'm so queer. So using, like, I think this one's from UC Davis, and there's some really interesting things like embedded that if people want to take a look or make a copy, it's awesome. But the language is really evolving, so feeling like asking the people you're working with about their identity and what that means to them. Because the words you might think mean one thing, but might have a really different personal definition. And that kind of brings us to like, what questions are you asking people about their identity and their pronouns? Like we all went around and used pronouns or asked for pronouns, but I think also another consideration is like, are you doing that in a room full of people that you think or look pretty cisgendered? You know, like, oh, there doesn't look like there's any trans folks here. It doesn't look like, and like just some of those assumptions, like are you only asking the clients that you perceive to be gender non-conforming, if they are? Are you only asking certain questions and like some of those biases? Some ways around that I've started to see are like on your email signature, just including your pronouns, and can be a very subtle way of like inviting that conversation with folks of like, oh, what does that mean? And that can be with other cisgendered folks. It can be with, you know, in interactions with clients, they're like, oh, this person understands that like pronouns are not given necessarily. So, but also understand that like some people might get a little defensive. People are like, are you asking me that because I'm, you know, and other people might be like, thank you so much for asking. And just rolling with that experience. You know, there's not any one singular experience around that. So names, and yeah, so names is an interesting thing, particularly in therapy, names and pronouns. You might have a trans client that wants you to use a chosen name, and you might be the only person using it. They might only be out to you. So being clear with, like, knowing who they're out to, and vice versa. Maybe nobody knows they're trans, and that's might not be anything that you're working on in therapy. So, but being like, do the parents know? You know, if I'm working with, you know, some kiddos, like, parents might not know that their gender identity is something that they're working with. It might not be safe for them to do so, and vice versa. It might not be safe for you to not use their chosen name or pronouns because you might be accidentally outing them. If they're somebody that's more passive. Other considerations are like at this institutional level, so like legal name changes. This happens all the time at my clinic, and it's something I'm desperately trying to work on. Person comes in, their legal name is Jason, and you know, they have to check in at the front desk using their dead name. So they're Jason, you know, and the receptionist kind of looking at Jason, you know, and they're getting all these like books, you know, and like, so by the time they come to my office, because I don't work in a specifically, you know, and I'm not, you know, don't work at like a specifically LGBT health center. So they've been dead named 4 times before they come into my office. They really want to talk about it again, you know, like, so some of those movement indicators that they're already feeling maybe more bound or more defensive because they might know they're safe with me, but they've just been traumatized multiple times before they came into my office. So those are some considerations. Other considerations around the trans experience that I think sort of relates also to movement stuff is this wrong body narrative that I think historically has been how people think of it and adheres to a very binary sense of gender and identity. So wrong body narrative is that like, I was just born in the wrong body. You know, I was born and assigned female at birth, but I really feel like a man inside. That's a relevant and very valid experience for some trans folks. However, that is not the experience of everybody. So really having these conversations and figuring out where people are at with that. Because another way that people experience that is experiencing their gender in less of a binary sense. And this came up in some of our conversations earlier around assessment tools where like masculine traits are over here, feminine traits are over here, and we're existing on this kind of linear binary sense of like these things being polar opposites. They're not. They don't have to be. What if gender was like this 3-dimensional, intersectional space we all live in? What about that? That'd be interesting. So in some of those narratives, you can talk more about things where gender or body dysphoria might be a really real part of somebody's experience, where their body feels incorrect to them. You might also have somebody that experiences more social dysphoria. So that is the experience of like, my body's fine. What's wrong is all of y'all thinking that I am like this. And figuring out where people are at. They may feel really comfortable with their body, you know, but it's people's reaction to their body. And that's a different space. So just some considerations. And then additional risk factors kind of generally within the LGBT spectrum, along with like gender and body dysphoria or eating disorders, which can have kind of a different tracking. So either restricting food or overeating to mask secondary sex characteristics. So just putting a different lens on some of the other co-occurring or comorbid situations that people are dealing with, like what's going on with food, why is weight and body, you know, where is that coming from for this person? Substance use, there are some substances that are kind of more in favor in gay and queer culture, particularly within like the club or party scene, particularly crystal meth, which isn't necessarily one that we see or hear as much about, but that can be, or Molly or MDMA, just because of the way they exist in scenes and subculture. Considerations of like housing and job security. If you're not passing and you're trying to get that entry-level job at Dollar Tree, you know, in very similar ways, like you have like one, you don't get to mess up, right? They're already giving you a chance, you know, by letting you get this job. It's like so people's just financial and housing security is very fragile. Other considerations are so this is the thing that, I don't know if there's any research on this, but just something I've kind of anecdotally found. In a similar way to how like young black men in schools tend to get overdiagnosed with ADHD or intermittent explosive disorders, ODD, these kind of things, we may also see an overdiagnosis of bipolar disorder within trans femme folks. So I see a lot. So like, is it borderline personality or is it complex trauma? So this is another thing. Just kind of an area of questioning for me because I see a lot of folks coming like, I have all these diagnoses. Okay. That might be true, might totally be valid, but also like, is there some bias in the system and just in our inherent pathologization? Okay. Pathologizing? Of people that don't conform to what we think they're supposed to. That's a lot. Yeah. So, questions for the group later, questions for the individual later.
Hello, so I'm Rebekka. I graduated in 2000, a long time ago, and had worked at Juvenile Medical Center and at the Rentry Center before I went back to the PhD program in 2015. And when it came to decide on my topic, I vividly remember it was January 2017, and Trump signed the executive order that would ban 7 countries from entering into the United States. And I just had this really strong response to that when I heard it on NPR. I was like, I'm going to have to do my study on refugees. It has to be. Even though there's probably not going to be any, Sherry and many others said, you should think ahead. What would you like, your career to be like? What do you want to, where do you want to place yourself? And I was like, this might just be the one thing that I do, and I don't know if I'll do more later on, but right now I just have to do this. So, backstory, I'm an immigrant. I come from Germany, and I came in '92, and I just 3 years ago became an American citizen, only because I could also keep my German citizenship. That was very important to me, because I have really struggled with being never quite fitting in this country, and just always feeling like, I get it. I love the people, and I'm married an American. I feel very much at home with him and with my children, but there's still something that's just going to be a little bit different. And so my heart just went out when I heard about this order, and I was thinking about people who cannot stay in their countries because of war, because of terrible situations, and then they're not even wanted in another country. And it just really broke my heart. So anyway, so that was the backstory. And so my journey with refugees started a year and a half ago when I went to Germany, and I spent some time at a temporary refugee center that at its peak housed 2,000 people in Heidelberg. It's called the Patrick Henry Village. And I spent my time with the children there. They were preschool and elementary age kids. And I did some movement groups with them. I did, games. We played some badminton, Uno, lots of Uno. I learned the Arabic colors and, the names for the Arabic colors, the Arabic names for the colors, and drawing. And so that was really a nice kind of way for me to get to know the population. And then I did my practicum at the Nationality Service Center, which is very close, about 10 minutes away from here on Arch Street. And it's a wonderful resettlement agency. They provide legal services, often for free. They provide social services, and they provide language for refugees, asylum seekers, and I was in a little unit that was specifically for survivors with torture. So I worked individually with one woman from Venezuela who was a survivor of torture, and also a woman from the DRC, the Democratic Republic of the Congo, and with a woman from Haiti. And then I did my groups with mostly women. There were some men that came, but it was always more fun when it was just the women. And it was amazing because it was sort of the regular people that would just come week after week, and I would get to know them really well. And there was the African contingent and then the Asian, and they just loved each other even though they were so different from each other. So that was really special. And I completed that last May, and then I sort of dove into my research, which is to learn how refugees can experience movement as a resource. So that has been a very long process. It's been 11 months. It was 11 months of data collection because it took me so long to recruit. And I just completed all that. I had 13 participants, and I met with them. About half of them I met individually with, and the other half we met in small groups. And that was in a church in North Philadelphia was the group. We were all Syrians, except there was one from Iraq. And then at the NSC was the other recruitment place, and HIAS is another resettlement agency. And I recruited, and then I invited them over to 3 Parkway, so I just completed that. And so some of the takeaways that I just wanted to convey to you are that it's good to assume that they have experienced trauma. It's kind of like the underlying assumption. So working with that in mind, just really working first on just creating a very safe space. So I always had the room prepared. I always cut up fruit and brought, snacks, and we would eat and just kind of spend time with each other in very broken English. The one challenge that I have that you others don't have as much is the language, because while many of them are motivated to learn English, it's just really a long process. So I would just get by with Google Translate, sometimes language lines, sometimes I would have an interpreter, but a lot of just, and typing, is that it? And just sort of kind of trying to read the body language and trying to just communicate in some kind of way. But so after creating this really safe container space, we often would just have fun. Like, I realized that I'm not going to be, getting to the core of their trauma story, but it's really about spending time together, connecting, being with other people, really almost like filling your time. So many of them were looking for work or looking for something to do, and so this gives them something to do. And I always brought music. Like, I had learned so much about their music. I always had them pick music and kind of lead their songs. And one particularly beautiful group, we just had lullabies that each woman would sing, and we moved to them. And so that was beautiful, just beautiful. And again, from different continents. I mean, different countries and continents. The other thing that I want to just point out is that boundaries are a little bit more blurry. I got a lot of I love yous and hugs and can you help me with this? Can you help me with that? Almost like you're the case manager, when that's not really what I'm trained in. But you just go with it. And in my research, when I had the groups, I did not expect that all the kids would come along. So I had one woman who 2 weeks after her C-section brought her newborn along, and another one had a 7-month-old that she nursed on and off during the movement session. We had kids running around. It was mayhem. But, you know, that's kind of the world that they live in, so I invited that in. And so it's really about being completely flexible, going with what you see, not having this kind of like, you're supposed to do this, or not like this. No, none of that. Just a complete flexible approach. Let's see what else. Yeah, 3 more things. So, again, this was mentioned earlier, to critically assess my own culture, identity, and orientation. Kind of think, you know, what are my biases going into this? And to be curious, to learn, and to be informed, not to be afraid to ask. That was important. And to give choices. That was something that I felt I really had to do because they have been robbed of their choices. And then the last one I put is get ready to be laughed at in a friendly way when mirroring. Because they don't expect, you know, for this Western woman to be like dancing with them. And then when it happens, they're like, oh, you know, and they laugh. And but it's a beautiful, beautiful thing. So just wanted to share some of these things with you, and I'm sure there will be more things to talk about when we have questions.
Hi again. Dr. Angela Grayson. I graduated this program in 2003, and I interned at Girard Medical Center, and I took like a week off after graduation and then went right back to work at Girard. So I worked there for about 7.5 years or so, and then went right into private practice from there. So I've been full-time in my private practice for about 9 years, and I primarily work with adults, and in that I've carved out the niche for myself of working directly with corporations and stress management, which has now turned more into my passion for working with women, which I did not know was there for me in terms of working strictly with women. And that came up most recently with everything that's happening on TV and in the media, and how women are portrayed to be competitive or to be really kind of be seen in this negative light, always arguing and never getting along, and so there's all of this clawing and fighting that's portrayed. And my take on that was that is not a full picture of what is representative of the culture of women. And it's kind of like an oxymoron, because if we look even a generation ago, women were considered nurturing and home givers, and really kind of holding down the fort at home. And so where did the switch happen for us to go from being loving, nurturing, supportive, community oriented to fighting all the time, nobody's getting along? It's not only a racial thing, but also within cultures, amongst generations. And so the work that I'm most passionate about now is bringing women together to look at commonalities and the ways that we do get along, and the ways that we can support each other. And so in my practice, when I'm working with women, I really talk about identity, self-identifying. Who are you as a person, as a woman, and what roles do you play? And how are you seen in your family unit? How are you seen at work if they are working? And really building on the strength that each person brings to the roles that they consider themselves or find themselves in. The reason that I am most passionate about that work right now is because I'm Black. You probably noticed that when you came in the room. But I'm also have Native American heritage, and so I'm in the process of exploring my Native American sides on both my mother and my father's side, and how does that play into who I am as a person. I identifying as a Black woman from North Carolina. And so I have like all of these kind of interesting mosaic kinds of qualities about who I am and how I'm showing up and identifying in the world. And about 2 years ago, my husband passed away, and all of my friends, like from, I guess, kindergarten all the way through graduate school, started showing up. And so that's when I really got this idea of working with women and really embracing the relationships with different women. Some of these women I had not seen since kindergarten. And so to see them after, like 40-something years was like amazing to me, that they would come to my house and to sit with me, talk with me, and share stories of what we were growing up. And like I said, from kindergarten through elementary, through junior high, high school, college, grad school. And so I'm like, if I really take a step back and look at these relationships from more of a clinical perspective, and through that lens, what did I learn from that experience is that there is still that element of offering support and being there, providing, nurturing, and really being open-hearted and understanding to suffering. Even just with not only the tragedy that happened to me at that time, but what's happening to us on a broader level across the United States, and also trickling out internationally, what's happening to us across the globe as women, and how can we get back to being supportive and really looking at people and saying, I see you, because that's the other thing that's happening, is that we're not really looking at each other or paying attention to each other. We look past each other or look through one another. And so my work now is more focused on really making those connections and really honoring the fact that I see you and I hope that you see me, and it's okay, and I'm curious about you, and it's okay to be curious about me, and that we have those interactions and that dialogue, even if it's in passing. So the exercise that I had you all do when we started, the walking and filling up the space and the making eye contact, that's significant because we're now living in a society that has us so separated and so internal and so self-centered and self-focused, which is so opposite from an Afrocentric point of view, but also from a Native American point of view, because those cultures are more about community, and everybody is interrelated or interconnected in some way. So how can we get back to the things that connect us versus the things that keep us separated? Not liking one another without even knowing why. So that's the work that I'm most passionate about at this time. I've created what I call the Girlfriend Retreat Experience, where I bring women together and we have conversation about some of these dynamics of who's in your circle, what purpose do they serve? Are there women in your circle that really are there to have your best interests at heart, or are there women in your circle who are poisonous to your existence, because we still do have that. And so really being able to identify who you keep close and who you kind of need to have some distance from or some disconnection. So my work is about connection and disconnection, so that we are maintaining proper boundaries to create relationships that both benefit ourselves and also benefit the other person on the other side.
So I just want to throw some things out. We can go into them a little bit. We can bring questions in and conversation in that this can inform or not. But two things that I thought about when I started putting this together are kind of like buzzwords around the ideas of race, culture, gender, sexuality, things like that. And two of the things that pop into my head are, first of all, microaggressions, which is kind of like keyword, buzzword right now. And I think if perhaps we want to spend some time dissecting how we're doing that, or what that means, or how we can become less microaggressive. The other thing that I think is really important, and I know you brought up Layla's book, and I'm really excited about it. It's on my desktop for months, and I can't wait to get into it. But the idea of allyship, and allyship within each of these communities, and I think that at times we have really great intention as allies, and we actually do some disservice within that. And I thought that perhaps those two things could be kind of really meaty things that we can bring into the conversation at this point. If you agree, you can speak to them. If you disagree, you can take questions from others.
I mean, I feel like I have a lot of different thoughts about that. We can just maybe have a conversation, and
Yes.
it doesn't have to be so like me.
Yeah,
But,
definitely.
but just to start us off, I mean, I think something I was thinking about even while, preparing to come here, was thinking about the idea of just like mistakes and kind of like if you're not failing regularly as a person who is in the privileged position of whatever, kind of identity, I feel like, at least for me, there's this acceptance that like, yeah, I'm gonna just fail because I was trained to think in these certain ways, but if I'm not failing, or if I'm not having sort of occasional times where it's like, oh, you said this thing, or you did this thing that didn't really go over very well, that it means that I'm maybe not taking enough risks. So like that's kind of where I'm not like putting myself out there enough, or really like being fully present, and like maybe keeping myself insulated, or like hiding in some way. So to me that kind of speaks to the microaggressions and the allyship, just that like, yeah, with friends of color, or like if there isn't some kind of thing where we have some clash or we have some uncomfortable conversation at some point, like I just expect that is just gonna have to happen, or like, and if it never does, like we're probably not talking about something, or there's something that we're like kind of not glazing over, or yeah. So I think that's just one thought I had, just kind of about like and then how can we bring bring love to that as well, to sort of to all those interactions, like healing from microaggressions, or trying to find a way that we like can hold each other, but and there's also just so many different ways to be allies in different contexts, like the but I think those are my thoughts. I think there's a lot of like with allyship, a lot of like sitting back that needs to be done, and really like challenging your ability to listen. And even the term ally, like, has been called out as like, is this even a helpful thing? Because people get really caught up on it and think, oh, I'm an ally. Whereas it might be better before you give yourself a title to just kind of look at what the behaviors are that you're doing, and like, am I acting in solidarity with this group, or am I like acting ethically or acting in shared humanity, as opposed to like when we try to give ourselves this little like pin. It's like, it's nice to show that like, yes, I'm a safe person to talk about this thing, but also just like, what are you actually doing first before you get caught up on that piece of it.
It's the embodiment of allyship versus the title of allyship.
Yeah, totally. Like, what's your walk as opposed to what's your walk.
I think it's not so much about like not making mistakes, but when we do make mistakes, how we show up for it, right? And I'll use, since I'm here to be like the spokesperson for LGBT, like, so a common one would be like misgendering somebody, and the difference between like, oh my god, I'm so sorry, and like calling someone like calling more attention to yourself in that moment, and then the other person's like, no, this is totally okay, and you're like, versus like one-on-one later being like, hey, I totally caught myself, or I'm gonna do better on that, and just like not making it as big a deal, like, or maybe you don't need to say anything. Are you making an apology for your benefit or for the other person's? And looking at how we're repairing the tears that will happen, and I think that those can actually become really important opportunities for building a stronger relationship. can make these mistakes and actually grow and create a bond around that, or not, or accept that somebody's like, that really hurt, and like I can't, and be able to step back from that and do that, go somewhere else and do that work on yourself, or let your space and time to do that. I was thinking a little bit about the allyship, and in my scenario, I think it's good to draw this differentiation between being a really helpful support and sort of being in the way of someone finding their own way. If that makes sense. Because I felt there were times when I would be asked things that I thought they could really figure out on their own, or I could, and it was hard. It's hard to know sometimes. Are you enabling somebody's helplessness, or are you, or do they really don't know it, and do they really need help in this moment? And so that was something that I struggled with sometimes, just knowing, drawing the boundaries where this is okay, and this is really going to be a little too much. Just kind of knowing that.
And I don't know, when you asked about that, I just thought microaggression is not just things that we say or don't say, it's also our actions, like how we approach people, how we stay away from people. Like language is really important, but also just dynamic and interaction, and it happens on various levels, right? It can happen from us, place of privilege, having a certain education, gender, race, ethnicity, but it can also happen like people on the same level, right? So I've experienced it where it happens with my clients against me, also coworkers, right? People that are there with me. And it's not always things that are said and things that aren't said, or things that are implied, right? And so it's, as an ally, being open, right? And being able to have those conversations, as we were talking about, and accept it. And also not jumping to fix it, because sometimes there is no fix, right? As someone that has experienced microaggression, sometimes I just want to vent, right? And I just want the space to be able to say, this is my experience and it felt really bad, it made me feel really bad. There's nothing you can do but listen right now, right? And I think a lot of times as therapists, as people, we want to help and jump, and especially from a person with privilege, that can also be a microaggression. Like, I need you to fix this for me. I don't always need you to fix it, I just need you to listen and be open, and to then again look at yourself and not take it personal, and have those conversations with yourself and with me about what you can do better. Sometimes it's just asking, what can I do? And there may not be anything. I just need you to hear this experience from me and our client, and that happens with our clients also.
Absolutely. Can resonate with what you were saying, and I guess when I think about that for me, especially when the microaggression is towards me or against me, my question is always, what do you mean by that? Or what is it that you're really saying? Or what is your assumption? Which then causes pause, of course, when you're kind of like, wait a minute, what do I mean by that? Or what am I trying to say? Or what is my assumption? So my pushback is always a question, because I want the person to kind of be mindful of the language or the thought. And so if I'm countering with a question that always presents, oh, I need to take a look at that. So whether it was intentional or it wasn't intentional, it always kind of opens the space for us to have a deeper conversation, or not. But at least I know on my side of it, I'm like, I heard what you said, or I saw what you did, and I want you to know that I heard or saw you. And so that's always my pushback. Stuff like that.
Just as you mentioned the word pushback, I am thinking about this exercise that that I came across in a book, in an article that we shared with our class now, the social and cultural class. So the stop spot model, is like a kind of a intervention for microaggressions, and it's about this pain of social exclusion or social pain. Social pain overlap theory. So this is like the idea that like physical pain and emotional pain are the same, and so like microaggressions, which are like, it's so funny that we say micro because like it's aggression, you know, like it's still, yes, I guess it's like micro, but it's pain, it causes pain, and so from relational cultural theory, there was these two relational cultural theorists like developed this model called the stop spot model. So it's like the idea of us as like being an intervener, like pushing back on something, and then actually that pushback is like healing in itself, like to name it and to kind of say like this thing happened, and I'm not like if I was to sit here, then that pain just kind of continues. But if you like intervene and you say something, there can be that healing experience right there. And so, if anybody's interested in that, I could send that article to you. But I thought it was really fascinating, kind of how they broke it down, like sort of like, and it's very body based as well. Like you like see, and then you're like seeing what's happening, taking it in, you know, that sense. Then like talking and telling, and making sure you say something, like so using your voice, and then like empathizing, so using like your core and your body. And then also like protesting or, you know, making some kind of change. So I feel like this can happen on like a really micro way and then in a bigger way as well. But anyway, I got really excited about it, and what you were saying reminded me of that. Because I think that we have, like these tools, like being body-based therapists and healers. I think that to sort of feel when you see something that doesn't feel right, and to like actually when we're living in our full like selves and feeling fully embodied, it's easier to be like, ooh, like that's not okay, and it's easier to then be like, I don't feel good about that, you know. So it's, whereas if you have a lot of stuck energy and, you know, kind of like not feeling embodied, I know that that's the times for me where I'm kind of like, oh, I see this thing, but and then later I'm like, oh, I should have said something about it. But yeah, when you can fully be present, it's easier to just have that response in the moment. So
Also, want to point out that microaggressions are not always intergroup. Sometimes it's intragroup. So we have internalized biases and stereotypes and generalizations. So it can happen from someone within the same group as yourself. So from black woman to black woman, black person to black person, therapist to therapist, man to woman, you know, queer person to queer person. It can happen in a group also. So it's not just someone that identifies as something other than themselves. Which is even more insidious and takes like it's nuanced and it's made harder to, I don't know, it almost feels ickier sometimes. Like inside, like you're supposed to get me, right? We have the same thing, you're supposed to get me, but you don't, and you just said this thing is really hurtful to me. So that's also something to be aware of. We can be microaggressive to each other.
And I think because of trauma, like shared trauma, because like I think we talk about this a lot in like queer community. I've talked about this with people, like people just have a lot of trauma, a lot of like, and like people of color, like you just this carrying around this trauma and of maybe not belonging or being other and not being safe. And then so when we did this walking exercise earlier, and Angela said something like someone who's like you is walking next to you, and I thought of that for a second. If I'm like with another genderqueer or like queer person, like sometimes there is this like I don't know if I can be comfortable with you. There's a lot of like internal policing that goes on of like, are you queer enough, or are you like, do you have all the things right, or do you know? So so I think there can be like, I just relate to that a lot. I mean, it's true because it's like the trauma of the society, but then people perpetuating it with someone that you should actually be like building up. So
I was just thinking what you were saying there, that too, also related to what Angela said earlier about women not supporting women. You know, it's just it's a similar thing, like two women who might should be supporting each other or fighting or whatever. Or that's sort of a woman who needs each other. about how we can really use as therapists too. In the awareness of
So I think at this space, let's just kind of come together. If you have comments to add, if you have questions, specific or general, but let's make this more of a conversation together. I think at this point would be fine. Yeah. If anybody has anything. Or the panelists can just continue to speak.
Don't make us talk at you.
I'll say I'm hearing this like when somebody walks up next to me and they're like me, that you were saying. And I feel like there's something in this that I'm not allowed to feel, is that when a white person, a white, straight, cis person walks up near me, I'm already like, ew. Like, I have this feeling about my own being and people, and I think there is something about, like, there's not even comfort, or I know I feel often, I don't feel like I associate with American culture, with white culture, with feminine culture. Like, those are all things that I represent aesthetically, perhaps, but don't identify with in a way. And then sometimes I feel like, well, I'm not allowed to not identify with who I am, because it's who I am and I have to identify. And there is this disconnect for me, but then I also feel like an intruder, because I don't feel like I'm allowed to identify with different cultures or genders or representation that I am not myself, if that makes sense. So if there's any just comments on that.
It makes sense. I wonder though if most people feel that. That's kind of what I sometimes wonder, because I feel that way too. And then I think most people feel like in the end it's very hard to have a true sense of belonging. Like, I don't know. What do you all think?
I think that, like, because the times that I've experienced that, a lot of it has been sort of like projection of things that I kind of am uncomfortable with in myself. And so, like, if I'm like, oh, I just, like, I know I'm white and I know I do all these things and I try to love myself as I am, but also, like, you know, like, I'm gonna keep doing these things and they're so annoying, or, you know, but like, or anything, any kind of like thing, or like, yeah, being like socialized female and feeling often like that was like forced on me, and so it's like, but it's also a part of me, and maybe a thing I have some work to do on, like, connecting with my internal, you know, my femininity or whatever, my femme side, and so like things that I'm uncomfortable with in myself, like when that person who is like me, it's like there's some projection going on there of stuff that I haven't quite like wrestled with yet, but this also just, you know, because we're talking about belonging and like disconnection, and I do feel like something that I feel like within oppression and, like, you know, capitalism, there's this lie of disconnection that keeps us separate. And, you know, Angela, you were touching on this, bringing up like Native American cultures, and even if you trace back, even for white people, you know, like trace back far enough, where were your ancestors where they were living in more harmony with the land and more in connection with other beings, or having a more nature-based spirituality, like that would be in there somewhere. But just this idea of like disconnection and belonging, I think, keeps us separate, you know, keeps us, when you feel like, oh, I don't belong, there's less motivation to be like, I'm part of this thing, that like we're all in this together, and so I think just,
As you're talking, Erika, I'm also thinking about the idea of what's happening in society right now, too, politically, and how politically there's liking to divide us, right? Like Republicans, Democrats, this group, you know, it sort of also filters down from society. It right now in the U.S. at least, that idea of just being separate, being different, and, you know, being against each other in some ways. And that narrative is kind of pretty alive, at least for me right now, you know, because we hear issues all the time and sort of get the present.
I think back to the experiential that we did earlier too, with the power over and power with, and how so many of the movements with power over were disconnected and we're pushing people down or going above people, and then the experiential with power with was so much connecting and joining and mirroring and reflecting. So I think that was relevant.
I have a totally different question, and and it's okay if you don't want to answer it and you want to keep this going. I find it really interesting that all of you are working with a population that is really close to your heart, and that it's really a piece of you. Like, you bring yourself to this work, and it's a piece of you. You're working with folks who are kind of going through something that you have a connection to that. You have a connection to that, and it's really a passion of yours. And I'm curious to know. I don't have that experience, so in my clinical work is what I'm saying. Not the passionate part, but the piece of when I was younger, my clinical friends, my colleagues, had said, you know, Adita, you should really get into work with infertility patients because you have that experience, and I think you'd be great at that. And I would be like, hell to the no. I'm not ever going back to that place. I don't want to. I worked on that. I'm done. I don't want to do that. Yet you're in this place. That's what I'm trying to say. You're in this place that's very personal, from what I'm hearing, and I'm just curious to know about that experience.
I think for me, it was important for me to give my experience a voice. Because that was all part of my healing process. And so it just kind of evolved into what I'm most passionate about now, because going through that experience of losing my spouse and dealing with everything that happened after that, it's like, okay, am I going to survive that? Am I going to be able to open my heart to love somebody else? And so all of these what ifs came up for me, and in that space, what I found was a lot of women reached out to me who had also lost their spouse, and so that created a sense of community for me. It's like, I knew I wasn't the only one who ever had the experience, but I didn't know anybody personally, so I thought until I had the experience, and the people who I knew were like, yeah, I've had that experience before, and I didn't know that they had, because nobody ever talked about it. And so that was really eye-opening for me. It's like, okay, now that I've had this experience, these people that I see all the time, on a weekly basis, like, yeah, I've had that experience in my younger days, if it was an older person, if it was somebody more my age, and I just didn't know that they had the experience. It's like, wow, how did you get through that? And so now, being on the other side of that, it's like, this experience has shaped my worldview in a different way. And even when I do the Growth and Retreat experience, I talk about why I'm doing that particular work right now. And it always resonates with at least one or two people in the room who have had that experience, or know somebody who has had that experience, and how the support is so integral to the healing process. Because it brings up all of these different things, like, will I ever find another partner? That's been important for me to explore that, and being privileged enough to have a group of women who value me to offer that, and to help me kind of navigate that experience.
Speaks to kind of a different aspect of that too, is that, so I think earlier in my career, I was very conscious of how I was dressing and what my clients working with me were going to take from that. And out of that came this very strange experience for me of being had almost an entirely separate wardrobe of work clothes and like my personal life, which I like justified from this like academic setting of being like, oh right, I come home and then I become myself. That's part of my self-care. And it was fine. That worked in a certain way, but I think I've become a much stronger clinician the less like separation there is in that, and that there's more of myself. And I work in community behavioral health, so I see everybody. Most of the people I'm working with are straight cis folks, and it's so important for me to be there and for them to have. When we talk about like microaggressions, it's that funny thing when people are like, oh well, like they're gay, but there's nothing wrong with that. Why are what do you mean by that? Yeah, it's like in this way that it's like they're not going to ask me about my identity because of this hierarchy that's set up, probably. But it'd be great if they did. It's better for them to ask me than like be asking really offensive questions out in the world. But I have found as I've been in clinical practice longer and become more secure in myself, right? Because I think for me, so much of doing this work is also like asks you just to be continually working on your own healing and growth. Which I didn't know that was gonna happen. And it's been wonderful. So I think that the longer that I've done this work, that I'm also like I get to be an advocate for like when somebody like when I'm working with straight folks and like that or don't necessarily even have any framework of like what to do with me. And then like I've had clients say, well, you're like really very very modest woman. I'm like probably not gonna break that down right now because that's not what you're working on, but thanks for that projection. Yeah, so I think just for me personally, that the less separation of like my clinical self, like this is what I do over there, and then I come home and be this other person. I've just become a much stronger clinician. There's much more of me in the practice, which it feels sort of strange initially, but like these ideas of like the neutral therapist. Like, it doesn't work when you're dancing with a therapist. Like you're dealing with all of this. Like how are you supposed to say like I'm just gonna be on a couch with you? I tried that too. I tried to go see an analyst that you didn't look at them and they just were writing notes the whole time. It was really weird.
For me, I feel like since I started like in grad school, I always like had the idea that I wanted to work with adolescents. So that was very intentional on my part because I had an experience with a teacher that came in and like really made a difference through the arts specifically. And so that was very intentional. But now being at the Justice Center, that wasn't intentional. But similarly, I found more of myself in that work because I can identify with some of what the kids, and I call them kids, but some of them be like 20, not kids. They're kids to me though, so I call them kids. But I can identify with some of the experiences growing up in a community that under-resourced, lower SES, even though that wasn't my particular experience. But also, so like working with adolescents was intentional, but where I find myself in juvenile justice and working with the particular kids that I work with kind of just found me. But also like it fuels me because again I can feel like it can be more of myself. So in working with adolescents in this setting, I find that being more transparently myself, so I don't have that separation as much, right? And I feel more comfortable presenting my personality in how I dress, how I speak, right? Using standard American English versus African American vernacular English. And now, initially coming to grad school, I was very cognizant about separating those two. And so like, if people don't know, like African American vernacular English is slang or, non-standard English, right? Not the things that we're taught in school, not academic English, quote unquote, right? Which in this country has a certain connection to intellect, right? If you speak standard English or academic English, you're smarter. If you don't, then you're not as smart. And so now working with these kids, I find that I have to, it works better for me to connect with the kids when I use Ave, which is, I'm not trying. Sometimes I have no idea what they're saying. And again, I just ask. what is that word? Yeah. Can you just speak regular? Like, I don't understand what you're saying to me. But also being able to incorporating more of that, like how I speak outside of work, so there's less of a disconnect for me, right? Because like I speak one way to my friends and my family from home than I would in a classroom or in a meeting. But now working with the teams that I work with in this particular setting, it's kind of integrating more, which feels better to me. It makes me feel more authentic, and I think it helps me as a clinician, as a person, which I think is important, especially working with adolescents and people that are underserved, right? That transparency and that authenticity is really important in building that relationship and that rapport. So working with this population has been more integrating my personality and my professional and personal life, which is really, it just feels better.
I think this is an interesting conversation in that oftentimes in school as a student, we're taught don't self-disclose, be a blank slate, right? Going back to the Freudian traditions of being blank slate, right? We do here at Drexel a lot of psychodynamic, psychoanalytic, right? And I think it's really interesting to just consider how much, okay, so again, I'll use myself as a white female, right, that dresses a certain way and speaks a certain way. I'm assuming I can be a blank slate. If I am a black woman, well, that part is different already, right? You can't hide your blackness. That's a part of you. I feel like some people think that I'm straight, some people think that I'm queer, some people think that I am in between. I feel like that part I can be blank slate with, but just this idea of, is it really possible to walk in and be blank slate? And do we want to? And as a new learner or a new clinician, how do we distinguish where to draw the lines, right? When people walk in that we assume are one thing or another, we have assumptions, right? So some of those, perhaps pretending like you can be a blank slate, is silly. It's silly. And so then do you embody them and embrace them in a way that stays safe to you and safe to your population that you're working with? So I'm just talking. Because I know there's a lot of students and a lot of new clinicians, and I know that one of the things from the ADTA National Conference that I've been considering a lot is, what are we teaching? What are we not teaching? Is this still relevant? Do we need to kind of shift? And how so? And so in a program that some of you are in or just got out of that we're saying, blank slate, watch what you disclose, we're already disclosing by showing up. And some more than others.
And now we're hearing, be authentic. You really need to be authentic. You need to be real with people.
Yeah.
Which I know
so just
resonates
to
with me.
highlight a little bit about.
I'm wondering too about like this, where that idea came, right? Where it came from, right? Is from these like Freudian roots of like, and it's like what professional is and who trust is, right? Which there's some inherent bias. The most trustworthy person is a straight white male. Okay, that's in the system, right? Like the system says that, like we can all have our right, but if you're presenting as something other than that, which I don't see any straight white men here, right? Like most dance music therapists, at least in this room today, identified as she, her, hers. Is it a song that came out? I was hearing that. I was like, this is so funny. Yeah, like where is that like? Why is it less professional? Why is it less to use vernacular, right? Like why is that less intelligent? All those assumptions that don't just come from us, like they're also coming from the people that we're working with. So maintaining this level of professionalism and finding this balance, but also like you're gonna like working with adolescents, like they're not gonna respond well to that professional, right? Like then you're just like another authority figure telling you what to do,
Just a really quick thing. We all know that relationships are the most important thing in therapy, right? I mean, the way they feel with you, the way they can trust you, the way they feel comfortable with you and safe. The
people do not feel safe with a blank slate. I really don't think so.
I was gonna say too, I think the biggest thing I learned, like, took away from school and now practice is I always like ask myself, like, why am I doing this? Like, who am I actually serving? So you said that before, like, you make a mistake and then you like immediately apologize. Are you apologizing for you or are you apologizing for like your client or patient or whatever? So I think for me, it's not. I'm obviously not a blank slate. Also, like very racially ambiguous. I think that people like tell me all the time, and that comes up a lot. With I work with adolescents a lot too, and for me, I'm always asking myself, you know, with like self-disclosure, with anything I do, why am I saying what I'm saying? Like, is it for me or is it for them? You know, I work with a lot of art therapists who are also very psychic organic, and most of them are just like, no self-disclosure, and I'm like, I don't work that way. Like that's just not how I work, and especially when you're working with like adolescents, I think that's the worst thing to do is to not tell them anything about yourself. You know, that's been my experience so far. And I also think I like had a question that was like the opposite of Tina's, like when you're working with someone who you're not from that same community. So like what I have been coming across are a lot of kids who come into crisis identified in the LGBTQ community. We have such a like high number of kids who come in, and even they don't have like the vernacular, they don't have the knowledge, they don't have the education because they're not. The system is like so broken, and they're not learning it. I feel like that has been like one of the hardest things too, and like not being from that community, and also not having like, the knowledge.
You know, that's a great point. And it reminds me of this other piece, which is like education and exposure, right? Like you might be working with a gay or a queer kid who's never heard the word queer.
Yeah.
You know, I've like asked somebody that, you know, I've asked somebody that, I'm gonna out myself here, is like, you know, like one of these messier moments where I was asking somebody their pronouns and they're like, what? You know, and this was somebody that I perceived as being sort of gender non-conforming that might use other pronouns, and they were like, oh. And just had a different, because, just didn't have the exposure to like that language, just like, what are you even talking about? And had to hold, you know, also within all this vernacular and language is like, it's really different within POC gay communities and white communities, and you know, like that's like, and being careful of those like that intersectionality.
But I think like the question of like how much of your authentic self do you bring to the therapy is something that I've been thinking about lately, because I feel that our training, like as therapists, you're kind of on the giving end in some ways, and the focus is always on like how are we being mindful of the clients that we're working with. But then I've also found that if there are times when I'm like authentically being myself or engaging in self-disclosure, I find microaggression directed at me from the clients, and then it becomes a challenge of like, do I continue presenting myself this way, or like how do I make sure that, or like how do I even start this conversation with them, because they're not here for that and they have very clear goals which are not relevant to this. But then it also affects the therapeutic relationships. It's like, how do you ensure like a strong therapeutic relationship, but at the same time, because in some ways you're also told that you're supposed to be modeling like good behavior for your clients, but if you can't model standing up for your, like one of your goals is to help clients stick up for themselves, but you can't do that for yourself in those instances, like it becomes so tricky to navigate, because like when you're a therapist, you're not just providing therapy, like there's a lot that goes with that role. So how do you balance that when something like that is directed at you, like it's coming in the other direction?
I think it always goes back to like intention, like redirecting or standing up for myself. Is it for me right now to feel good, or is it modeling good behavior? You know, appropriate responses to the client. And sometimes, I mean, sometimes I think it has to be for you because you have to still be present in this work. So you have to do what you have to do to stay present and to be there with your clients. But also think, again, always asking the question, what is this going to do? We can divert from the treatment goals right now, right, just for a second, because it'll model for the rest of the group also, especially in group settings, right? Sometimes you have to set those boundaries for the group and stand up for yourself. One, because as a woman, I found that, and younger woman, people like to stand up for me, right? And so like, I don't need you to do that. I can do it for myself, right? So doing that in the moment, but also like supervision is really important. So constantly seeking supervision, especially if you find that happening a lot, and always your own therapy, right? So I think it's situational depending on what the context is, and supervision is always going to be like your go-to.
And also asking yourself the question, who am I being in this moment? And what is it that this person needs from me? Those are things that I always try to keep in mind in terms of self-disclosure. Is there something that I might share about my life that will help this person break through wherever it is that they're stuck in this moment? And if I do that quick assessment, and I feel like if I tell them this about me, will that help them also identify, wow, you see me and you get what I've been through, and you made it through the other side, and now you're living your life this way, then maybe I can too. So I'm always kind of checking in with myself, like if I tell them this thing about me, will that help them in some way, or will it not matter? If it doesn't matter, then I don't share. But if it matters to them in that moment, then absolutely. And the classes, many of you I've had in class, you can ask me anything at all about my life, because I feel that is important to be able to share life experiences, because just because we're therapists does not mean that we're not people. We don't have our own lives, and we don't have our own issues outside of being somebody's therapist. Because life does not pass us by, because we're helping other people learn how to better navigate their lives. And so being mindful of that.
Yeah, and there's even like some therapists have like models of like self-disclosure right at the beginning, like just like an article that we read in our class, like that talking about the different sort of like similar and different identities right from the get-go. But to me, it feels really like the bottom line is engagement, and it's kind of like, can I find a way to just like engage with this person around this thing that just happened to us or between us, and even asking that question, like I could see where like we both identify as women, and that's the thing that we share, and that might help me understand your experience as well. Are there other ways that like our different identities might impact our work? Or like, I'm from this background, you're from this background, like how would that make you feel about me being your therapist? Do you think that could bring up any issues for you? And maybe like building some rapport and trust before you have that conversation, or having that like the second or third session or the first session, but there definitely are some models and some therapists out there that are kind of like, just go for that and have that conversation right off the bat, just as like out of respect for yourself and the client, that like, and to just put those things on the table, because maybe there are certain clients like, and I don't do that quite yet, but I'm curious about it, and I do wonder if there's certain clients that if I was to be like, I'm queer or whatever, that they would maybe feel uncomfortable about working with me, and that is okay, or they might feel uncomfortable and we would be like, I think we can still work this out, or like, yeah, this could be an issue because I would worry that you don't understand my relationship, or that you're not going to accept my religion, something like that. But just that you could like have, as long as the bottom line is like engagement in the therapeutic relationship and respect for both parties, that I think those conversations can be like, you can find a way to have them.
I have a question on my assessment that I ask all my clients, which is similar to what you're talking about, Erika. That's just, do you have any concerns about doing the work together? Not just like an inroad, right? You get more specific about that, but yeah, are there any concerns that you have about, working with me or working in therapy, or yeah?
So I think for the sake of time, I do want to wrap this up to be respectful of everybody's time. Unless there's any final thoughts from the panel. You all have been super generous with your information and with your selves, so I want to thank you guys all for that, for being willing to come and talk to us about this and your experiences. It's been really wonderful. And for everybody that came, thank you so much. So thank you guys. I encourage everybody to continue the conversation, please. I think This has been, I think things like this are important because sometimes it's nice to have people give allowance to ask the questions and to make the mistakes and to be like, oh, we're all gonna screw up at some point. May as well just do it together and learn from it. So I hope that we all can find time to kind of screw up together and learn more.